Hello, you're watching Basic Hale. This episode is the second in a series of 5 videos rating the effectiveness, invasiveness, costs, and side effects of the treatment options for erectile dysfunction. In this video, I will rate penis injections and penile implants on a 5-point scale. In episode 1 of this series, I explained the rating system or scale that I will use to rate all the treatment options. Here is a quick overview of the rating system. Treatments that require incisions done by a medical specialist, however small the incision, will be rated as highly invasive. Treatments that do not require incisions but are performed by a medical specialist on an exposed part of the body are rated as minimally invasive. Treatments that require a medical professional to perform an injection or insert objects into natural body orifices, such as the mouth or anus, are also rated as minimally invasive. Non-invasive treatments are those that are performed by a man on himself or performed by their sexual partner, even if the treatment requires injections or the insertion of objects deep into the body. I believe that the other items on this scale are self-explanatory. If you feel that my assumption about how self-explanatory they are is inaccurate, please leave a comment in the comment section. Before we begin the ratings in this video, I would like to ask you to support this channel. You can do this by subscribing to Basic Hale and giving this video a thumbs up. This will help me to produce more informative content like this one. Let us begin by rating penile injections. Firstly, it is important to note that penile injection is probably never the first line of treatment for anyone. This is mostly considered after oral medications and other treatments have failed. Drugs like alprostadil, papaverine, and phentolamine can be self-injected directly into the penis. The first injection is usually done by a doctor or supervised by a medical expert for the man to learn and practice how to do it on himself. All these drugs promote erection by relaxing the smooth muscles of the penis. When the penis is relaxed, it will easily fill up with blood and cause an erection. Fun fact alert. Remember this paradox the next time you describe a hard penis as excited. Actually, a man that is about to have sex is excited probably everywhere in his body, but his penis is relaxed. There is another injection called platelet-rich plasma, also known as P-shot. This requires a doctor to draw blood from the man, process the blood to make it platelet-rich, then inject it into the penis of the man. Another upcoming pharmaceutical preparation that is not self-injected is the injection of stem cells harvested from placenta. Both P-shot and stem cells injections are relatively new and experimental treatments for erectile dysfunction. They are not in popular usage compared to alprostadil, papaverine, and phentolamine. And because most men using penile injections are self-injecting these drugs, I have rated penile injections as non-invasive. A systematic review from 2019 shows that penile injections are very effective. Between 54% and 100% of men who have received this treatment show improvements in erection. Based on this, I have rated penile injections as highly effective. The price of one shot of alprostadil in the US is about $250, depending on the dosage and where you buy it. The cost is significantly less in Europe and other parts of the world. But for consistency in my ratings, I will use the US prices. The effect of an injection will last about an hour, give or take a few minutes. If a man engages in sex at least once a week, the yearly cost would be $13,000 in the US. I consider any treatment with a yearly cost of $10,000 or more as highly expensive. Here is a look at the side effects profile of penile injections. Priapism, for example, is a condition where an erect penis is not able to go back to its previous soft, limp state. As you can see, it does not happen a lot, but priapism can be a medical emergency. If it is not treated promptly, it can result in permanent structural damage to the penis. Another severe one on this list is fibrosis. This is a severe side effect because it means that the smooth muscles of the penis are being replaced with scar tissue. Apart from what you see on this list, 65% of the men treated with penile injections experience anxiety related to the treatment for many months, and up to 38% of them stop the treatment because of these and other side effects. Therefore, I have rated the severity of side effects as high. I will use the highest frequency on this list and the 38% treatment withdrawal rate that I mentioned earlier as my criteria for the overall frequency of the side effects. Based on this, I have rated the frequency of side effects of penile injections as high. Here is a case report about a man that was unable to remove the needle from his penis after injecting himself with prostadil. Now, this is a 70-year-old man that was probably losing his manual dexterity. Also, case reports are very low on the hierarchy of evidence in healthcare research, but this goes to show the kind of risks associated with penile injections. So, my final rating of penile injections is a total rating of 4/10. Up next is penile implants. Firstly, it is worth noting that less than 1% of men with erectile dysfunction will choose to have a penile implant. It is usually considered when other treatment options have failed. There are three types of implants. The semi-rigid is used by less than 5% of men who have penile implants. The inflatable implants can be a 2-piece device or a 3-piece device. The implant that has 3 pieces or 3 parts is the most popular because it is the most comfortable for both the men and their partners. So we will focus this rating on the inflatable implants. The implants are made of silicone or polyurethane tubes. The tube is connected to a saline reservoir and a pump. The switch of the pump is located usually in the scrotum. When the man wishes to have sex, they will activate the switch. The pump inflates the implant by pumping saline. This causes the penile to enlarge and harden. When the man is finished with sex, they deactivate the switch and reverse the erection. Penile implants are mechanical devices, and they will cause an erection 100% of the time, except when there is a mechanical failure of the device. Therefore, their effectiveness is better assessed by checking the level of sexual satisfaction of the men and their partners. This systematic review, published just a few weeks ago, shows that 80% of the men who have penile implants were satisfied with the outcome, while 76% of their partners were satisfied with the outcome. Based on this, I have rated the effectiveness of penile implants as high. As of 2019, the cost of an inflatable penile implant in the United States was about $5,700. This was reported in a systematic review published in 2022. Apart from the cost of buying the implant, the cost of the surgery to place the implant in the body was $15,400. This makes the total cost of $21,100 in 2019. When I adjusted this amount for inflation, the cost in 2025 is $26,200. Inflatable implants can last up to 15 years before they must be replaced. If we consider that the implant will last an average of 10 years, this amounts to an annual cost of $2,600. Based on this, I rate inflatable penile implants as moderately expensive. Penile implants are surgically implanted into the penis and scrotum. Therefore, the invasiveness of penile implants is high. The side effects of penile implants include mechanical failure of the device, meaning that it stops working. The device can also erode or puncture and go through the skin onto the outside of the body. It can also become painful or get infected. Any of these situations will lead to the formation of scar tissue, and none of them will resolve spontaneously. Therefore, I have rated the severity of the side effects of penile implants as high. On the other hand, the frequency of occurrence of all the side effects are relatively low. This brings the final rating of penile implants to 5/10. On the screen now, you can see the summary ratings of penile injections and penile implants for the treatment of erectile dysfunction. Thank you for watching this episode of Basic Hale. Please share this video on your social media to support the production of more content like this one, and I will see you in the next one.